Senate will come to order. I ask everyone to rise and recite the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. In the absence of clergy, let us bow our heads in a moment of silent reflection or prayer. Reading of the journal.
In Senate, Sunday, January 25th, 2026, the Senate met pursuant to adjournment. The journal of Friday, January 23rd, 2026, was read and approved. On motion, the Senate adjourned.
Without objection, the journal stands approved as read. Presentation of petitions, messages from the Assembly, messages from the Governor, reports of standing committees, reports of select committees, communications and reports from state officers, motions and resolutions. Senator Jane Ayers.
Good afternoon, Mr. President.
Good
We're going to start with an immediate meeting of the Rules Committee in room 332.
There will be an immediate meeting of the Rules Committee in room 332.
The Senate will stand at ease.
The Senate will stand at ease. The Senate will return to order. Senator Jane Ayers.
Mr. President, there's a report of the Rules Committee at the desk. Let's take that up, please.
Secretary will read.
Senator Stuart Cousins from the Committee on Rules reports the following bills. Senate Print 135 by Senator Claire, enactment of the Public Health Law. Senate Print 1012A by Senator Brooke, enactment of the Public Service Law. Senate Print 1327 by Senator Parker, enactment of the Public Service Law. Senate Print 1329 by Senator Parker, enactment of the Public Service Law. Senate Print 1438A by Senator Kruger, enactment of the Public Health Law. Senate Print 1633A by Senator Fernandez, enactment of the Public Health Law. Senate Print 1847 by Senator Comrie, enactment of the Public Service Law. Senate Print 1896 by Senator Mayer, enactment of the Public Service Law. Senate Print 5553C by Senator Comrie, enactment of the Public Service Law. Senate Print 5593 by Senator Mayer, enactment of the Public Service Law. Senate Print 5981 by Senator Fernandez, enactment of the Public Health Law. Senate Print 7165A by Senator Hinchey, enactment of the Public Service Law. Senate Print 7328A by Senator Hinchey, enactment of the Public Service Law. Senate Print 7693 by Senator Mayer, enactment of the Public Service Law. Senate Print 8257A by Senator Sutton, enact directing the Department of Health to establish an alternative payment methodology for federally qualified health centers. Senate Print 8759 by Senator Claire, enactment of the Elder Law. Senate Print 8760 by Senator Sanders, enactment of the Real Property Law. Senate Print 8780 by Senator Skoufis, enactment of the General Business Law. Senate Print 8793 by Senator Cooney, enactment of the State Finance Law. Senate Print 8817 by Senator Cooney, enactment of the Insurance Law. Senate Print 8830 by Senator Claire, enactment of the General Business Law. Senate Print 8833 by Senator Jackson, enactment of the Labor Law. Senate Print 8836 by Senator Serrano, enactment of the Environmental Conservation Law. Senate Print 8886 by Senator Adabo, enactment of the General Municipal Law. All bills report direct to third reading.
Move to accept the report of the Rules Committee.
All those in favor of accepting the report of the Rules Committee, please signify by saying aye. Aye. Opposed, nay. The report of the Rules Committee is accepted. Senator Jane Ayers.
At this time, let's take up the calendar, please.
Secretary will read.
Calendar number 53, Senate Print 1703 by Senator Webb, enactment to amend the Education Law.
Read the last section.
Section 6 is action to take effect 1 year after it shall become a law.
Call the roll.
Adabo, Giannaris Kruger, Orton, Stuart Cousins, White.
Senator Webb to explain her vote.
Thank you, Mr. President. I rise to explain my vote, and I first want to thank our Senate Majority Leader for continuing to demonstrate such incredible and necessary leadership on important issues such as reproductive health care. And so today we introduce a package of bills that are designed to strengthen protections for women's health care. This legislation takes a very practical, meaningful step towards ensuring that students on SUNY and CUNY campuses have access to emergency contraception by requiring that each institution offering in-person instruction has at least one vending machine on their campus where these items would be available for purchase. A number of reasons why this legislation is important. I'll just highlight a couple of things. This bill breaks down barriers to accessibility for students who may have difficulty getting off campus to a drugstore or other stores that would sell this important medication. especially given the time-sensitive need to utilize emergency contraceptive medicine within 3 days of unprotected sexual activity. Currently, students on college campuses across the state and country are working with various clubs and alumni organizations to bring access to these vending machines on their campuses. And most certainly in light of the Dobbs decision, which we know severely restricts women's access to abortion and continues attacks on reproductive health care by the federal government, it is more critical now more than ever to ensure that women have access to necessary medication such as this. Many times that access is limited by barriers such as pharmacy availability, transportation, and also cost, and also fear of stigma. Students who live on campus or in rural districts like mine or in underserved areas may not have the flexibility or privacy to get what they need in a timely manner. When we pass this legislation, we would join a few other states such as Connecticut, Massachusetts, and Illinois who have existing legislation in this regard. I want to thank you, Mr. President, for this important legislation, and I encourage my colleagues to vote aye. Thank you.
Senator Redd will be recorded in the affirmative. Announce the results.
In relation to calendar 53, vote in the negative are Senators Borrello, Keziah Fitzpatrick, Chan, Gallivan, Griffo, Lanza, Matera, Murray, Oberek, O'Mara, Ort, Steck, and Tedisco. Ayes 45, nays 13.
The bill is passed.
Calendar number 54, Senate Print 2058 by Senator Webb, enactment of the education law.
Read the last section.
Section 3, this act shall take effect April 1st, 2026.
Call the roll.
Adabo, Giannaris Kruger, Ort, Sewell Cousins, White.
Announce the results.
In relation to calendar 54, voting in the negative are Senators Ashby, Borrello, Keziah Fitzpatrick, Chan, Gallivan, Griffo, Helming, Lanza, Martinez, Matera, Murray, Oberek, O'Mara, Ort, Rhodes, Steck, Tedisco, Warzick, Weber, and White. Ayes 38, nays 20.
Bill is passed.
Calendar number 55, Senate Print 3155 by Senator Cooney, enactment of the insurance law.
Read the last section.
Section 3, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Sewell Cousins, White.
Senator Quinn to explain his vote.
Thank you, Mr. President. It's a privilege to speak in support of my legislation, which would provide greater coverage and access to in vitro fertilization here in New York. With the current situation at the federal government, we know it's important now more than ever for New York to take the lead when it comes to reproductive health care options. And this bill would do just that. Back in 2019, this legislature passed a landmark piece of legislation to require coverage for 3 cycles of IVF in cases of infertility. But unfortunately, healthcare companies have been requiring the use of all of the embryos in a specific cycle before covering the next, a situation that is not always viable, that delays the process, and often looks and limits the ability of women and families who are looking to start a family later in life. When a couple is trying to have a child, the last thing they want to do is wait and risk more potential issues down the line. Our bill fixes this issue, and I'm proud to support and sponsor this legislation to change insurance practices and create more opportunities for those looking to start a family here in New York. Thank you, Mr. President.
Senator Quinn will be recorded in the affirmative. Announce the results.
In relation to calendar 55, voting in the negative are Senators Borrello, Griffo, Murray, Steck, Tedisco, Warzick. Senator Griffo in the affirmative. Senator Gallivan in the negative. Ayes 52, nays 6.
Bill's passed.
Calendar number 56, Senate Print 4497 by Senator Hinchy, enactment of the insurance law.
Lay it aside.
Calendar number 59, Senate Print 8544 by Senator Hinchy, enactment of the penal law.
Read the last section.
Section 5, this act shall take effect immediately.
Call the roll.
Adabo, GNRS Kruger, Ort, Stewart Cousins, White.
Announce the results.
In relation to calendar 59, voted in the negative are Senators Ashby, Borrello, Kanzeri Fitzpatrick, Chan, Gallivan, Griffo, Helming, Lanza, Martins, Murray, Obaraca, O'Mara, Ort, Palumbo, Rhodes, Rollinson, Steck, Tedisco, Walzett, Weber, and White. Senator Martins in the affirmative. Senator Matera in the negative. Ayes 37, nays 21.
Bills passed.
Calendar number 60, Senate Print 8656A by Senator Mayer, enactment of the education law.
Read the last section.
Section 3, this act shall take effect immediately.
Call the roll.
Adabo, GNRS Kruger, Ort, Stewart Cousins, White.
Announce the results.
In relation to calendar 60, voted in the negative are Senators Ashby, Borrello, Kanzeri Fitzpatrick, Chan, Gallivan, Griffo, Helming, Lanza, Matera, Murray, Obaraca, O'Mara, Ort, Palumbo, Rhodes, Rollinson, Steck, Tedisco, Walzett, Weber, and White. Ayes 37, nays 21.
Bills passed.
Calendar number 96, Senate Print 8860 by Senator May, enactment of the domestic relations law.
Read the last section.
Section 3, this act shall take effect immediately.
Call the roll.
Adabo, GNRS Kruger, Ort, Stewart Cousins, White.
Senator May to explain her vote.
Thank you, Mr. President. I am proud to be part of this Senate majority that believes that abortion care is health care. If someone has sought an abortion in the past, it is in no way an indication that they cannot be a good parent. In fact, sometimes quite the opposite. And yet, a history of seeking reproductive health services has been used against parents in custody cases. This bill will stop that practice as one more means of safeguarding both the best interests of the child in a custody case and New Yorkers' ability to access reproductive health services without fear. I vote aye.
Senator May will be recorded in the affirmative. Announce the results.
In relation to calendar 96, voted in the negative are Senators Ashby, Borrello, Kanzeri Fitzpatrick, Chan, Matera, Murray, Obaraca, O'Mara, Ort, Palumbo, Rhodes, Steck, Tedisco, Walzett, and White. Ayes 43, nays 15.
Bills passed.
Calendar number 97, Senate Print 8866 by Senator Salazar, enactment of the insurance law.
Read the last section.
Section 4, this act shall take effect immediately.
Call the roll.
Adabo, GNRS Kruger, Ort, Stewart Cousins, White.
Senator Salazar to record her vote. Explain her vote.
Thank you, Mr. President. This bill would ensure that same-sex couples and LGBTQ New Yorkers will no longer be unfairly excluded from insurance coverage if they need to seek IVF treatment. It also will ensure that insurance coverage for IVF patients must include 3 full rounds of IVF. In 2019, New York enacted legislation to offer IVF insurance coverage to couples who are trying to conceive. The law requires insurance to cover 3 complete cycles of IVF, but it does not define what a cycle of IVF entails. And due to the lack of explicit definition in the existing law, some insurance companies began defining various steps in the IVF process as individual cycles instead of covering all the steps required to actually complete a single cycle of IVF. The result is that many couples are currently being denied fair insurance coverage for this essential reproductive health care. It means many couples are left to pay out of pocket, even when transferring embryos from what should be a covered IVF cycle or when additional cycles of IVF are needed. Furthermore, when multiple embryo transfers are not properly covered by insurance, it creates a perverse incentive to transfer too many embryos in a single transfer, which risks leading to poor medical outcomes for all involved in the IVF process. I want to thank my colleagues for your support in passing the Equity in Fertility Treatment Act today to correct this and to expand access to IVF in our state. I vote aye.
Senator Salazar will be recorded in the affirmative. Announce the results.
In relation to Calendar 97, voted in the negative are Senators Borrello, Gallivan, Helming, Matera, Murray, O'Mara, Ort, Tedisco, and Walzek. Ayes 49, nays 9.
Bills passed.
Calendar number 98, Senate Print 8869 by Senator Skoufis, enacting the insurance law.
Read the last section.
Section 4, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Just gotta go back to where it happens next. Announce the results.
In relation to Calendar 98, voted in the negative are Senators Borrello, Kenzari Fitzpatrick, Chan, Lanza, Rhodes, Tedisco, and Walzek. Ayes 51, nays 7.
Bills passed. Senator Janeris, that completes the reading of today's calendar.
Let's take up the supplemental calendar, please.
The Secretary will read.
Calendar number 135, Senate Print 135 by Senator Claire, enactment of the Public Health Law.
Read the last section.
Section 4, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Announce the results.
In relation to Calendar 135, voted in the negative are Senators Ashby, Borrello, Kenzari Fitzpatrick, Gallivan, Griffo, Helming, Lanza, Martins, Matera, Murray, Obarack, O'Mara, Ort, Palumbo, Rhodes, Rawls, and Steck, Walzek, Webb, and White. Also Senator Chan. Also Senator Tedisco. Ayes 36, nays 22.
Bills passed.
Calendar number 139, Senate Print 1438A by Senator Kruger, enacting amend the Public Health Law.
Read the last section.
Section 2, this act shall take effect on the 1st of April.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Announce the results.
In relation to Calendar 139, voted in the negative are Senators Ashby, Borrello, Kenzari Fitzpatrick, Chan, Gallivan, Griffo, Helming, Lanza, Martinez, Matera, Murray, Obarack, O'Mara, Ort, Palumbo, Rhodes, Rawls, and Steck, Tedisco, Walzek, Weber, and White. Ayes 36, nays 22.
Bills passed.
Calendar number 140, Senate Print 1633A by Senator Fernandez, enactment of the Public Health Law.
Read the last section.
Section 4, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Senator Martins to explain his vote.
Thank you, Mr. President. We had this bill in committee, in Health Committee, just this afternoon. and I do have concerns with regard to the bill. We have spent, as a state, tremendous resources making sure that our medical records are transportable, that these records are available wherever a New Yorker happens to be, because if someone is ill, unconscious, or needs medical treatment, wherever they happen to be in the world, Mr. President, we want to make sure that New Yorkers have access to their medical records and that that healthcare professional, wherever they may be, has a clear picture of this person's health history. And that's something that we as New Yorkers should rely on, and it's something that every New Yorker deserves, because it's about health. It's about this health and safety of our residents. And the reality is, oftentimes, or perhaps too often, the person may be unconscious, not be able to describe adequately what medications they're on, what conditions they may have. And so anything that prevents someone from being able to look at a health record and determine the best course of care for that New Yorker is something that we should be very careful about. And so people being able to limit their own records, that is, not include certain things in the record so that that future doctor does not have the ability to actually see the whole picture and may be prescribing or may actually be performing procedures that may harm that patient, that New Yorker who needs help. The whole purpose of digital medical records is exactly that. The idea that we will actually pass a law that allows people to remove things from there based on their own personal preferences, I think is contrary to public policy. It's against the effort that we as a body and as a state have had consistently. And you're going to hear, I'm sure, people say, well, given the climate, the political climate in the world today and what's happening in Washington, we have to do this. This isn't about politics. It's about protecting lives, and it's about making sure that we protect New Yorkers. Mr. President, I vote no.
Senator Martin is recorded in the negative. Senator Fernandez to explain her vote.
Thank you so much. And thank you for explaining your vote. It's unfortunate that you feel that this is irrelevant to the time that we're in, but this is very relevant. We're seeing this administration and this president right now attacking individuals based on their history, their choices. And this bill is very clear in informing the patient as to what they're wanting to do, letting them know their rights if they can opt in and opt out. And for those that are not medical professionals, and if I'm correct, I don't think anybody in this room is a doctor or a medical professional, this piece of legislation has been supported by over 200 medical professionals and providers, that this is a practice that is safe for patients in protecting their rights and the dignity to their health care. So I proudly vote aye, and I thank those that vote aye as well.
Senator Fernandez recorded in the affirmative. Senator May to explain her vote.
Thank you, Mr. President, and I want to thank Senator Fernandez for this legislation. Just imagine if you had an abortion in New York and then you found yourself in Texas and you had some kind of medical emergency, and you may be afraid to go to the hospital because while they would have to treat you for your medical emergency, they might also have to arrest you because they found out from your medical records that you had had an abortion. Or imagine you are a family taking a trip and you have a teenager who is undergoing gender-affirming care, and some medical emergency happens in a state where that is considered to be a punishable offense. And so you're afraid to seek medical care in that place. This allows people to protect some of that information, personal information that could be weaponized in a medical situation. And I think that actually could mean better medical care, or that people would be more willing to access medical care in those places. So I think this is good policy, and I vote aye.
Senator May recorded in the affirmative. Senator White to explain her vote.
Thank you. The Hippocratic Oath says, first, do no harm. And if we're preventing healthcare workers from knowing what's wrong with the patient, we're doing harm. And that's the patient's fault. And so I vote no on this bill. Thank you.
Senator White recorded in the negative. Announce the results.
In relation to calendar 140, voted in the negative are Senators Ashby, Borrello, Councilor Fitzpatrick, Chan, Gallivan, Griffo, Helming, Lanza, Martins, Matera, Murray, Obraco, Mara, Ort, Palumbo, Rhodes, Steck, Tedisco, Walzett, Weberton, White. Ayes 37, nays 21.
Bill is passed.
Calendar number 145, Senate Print 5981 by Senator Fernandez, enactment of the Public Health Law.
Read the last section.
Section 4, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart Cousins, White.
Announce the results.
In relation to calendar 145, vote in the negative are Senators Ashby, Borrello, Councilor Fitzpatrick, Chan, Gallivan, Griffo, Helming, Lanza, Matera, Murray, Obraco, Mara, Ort, Rhodes, Steck, Tedisco, Walzett, Weberton, White. Ayes 39, nays 19.
Bill is passed.
Calendar number 149, Senate Print 8257A by Senator Sutton, an act directing the Department of Health to establish an alternative payment methodology for federally qualified health centers.
Read the last section.
Section 2, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart Cousins, White.
Announce the results.
In relation to calendar 149, voted in the negative, Senator Walzig. Ayes 57, nays 1.
Bill is passed. Senator Gianaris, that completes the reading of the supplemental calendar.
And now on to the controversial calendar, please.
Secretary will ring the bell. Secretary will read.
Calendar number 56, Senate Print 4497 by Senator Henchy, enactment of the insurance law.
Senator Hummel, why do you rise?
Thank you, Mr. President. I would like to go on the bill, and then I have a couple of questions for the sponsor or the sponsor's representative.
Senator Helming on the bill.
Thank you. Mr. President, advancing real affordability requires at the very minimum understanding the cost associated with mandates like the one included in this bill. This bill will absolutely have an impact on healthcare premiums at a time when we have an issue with high cost of healthcare premiums. Premiums in New York State are among the highest in the nation, roughly 13% higher than the national average. On Saturday, I had a meeting with school superintendents, school board presidents, and other representatives from some of the 34 school districts that I represent. Healthcare premium costs were one of their top concerns. Schools have recently received notification of premiums rising anywhere between 21 and 30%. Similar concerns have been shared with me by our local governments, local municipalities who are trying to figure out how to cover these double-digit premium increases for their employees. In the blueprint for New York, it's a report that was prepared by the Public Policy Institute of New York. A top request from our New York State businesses is to reduce the cost of health care. When we're making important decisions in health care policy, we absolutely need sound fiscal transparency. So, Mr. President, if the sponsor or sponsor's representative would yield for a couple of questions.
Senator Bailey, would you yield?
Press 1 for representative. I am here. I am not Senator
Sponsor,
Henchy,
yield.
but I play her on TV today. Yes.
Okay. Through you, Mr. President. Senator Bailey, thank you so much. Great to see you. Can you tell me what the fiscal impact of this new insurance mandate, the impact that it will have on insurance premiums?
So, first and foremost, I think it's important to talk about the turmoil that's happened in Washington because of the healthcare turmoil. Has happened a lot because of what's happened in Washington with a certain bill that was passed. So that we can talk about turmoil. But in terms of how much this bill would cost, I think it roughly would cost the state $20 million overall for commercial plans, Senator Helm.
Thank you. Through you, Mr. President, the sponsor will continue to yield.
Sponsor, yield.
I yielded, and if I may, because I'm playing Senator Henchy on TV, it would cost the state $3 million, but the $20 million that I referred to was for all commercial plans. And I do yield, Senator Helming.
Thank you. Through you, Mr. President. Senator Bailey, the bill that we had before us says fiscal implications are none to the state. Is that accurate?
$3 million, the state would cost $3 million. That's, our staff has indicated that it would cost $3 million.
Through you, Mr. President, on the bill.
Senator Helming on the bill.
Thank you. Mr. President, when we're considering legislation with the potential to drive up healthcare premiums, this body absolutely should demand fiscal transparency. I sponsor a bill, Senator Bailey, I'll be bringing it to Insurance Committee, hope to talk to you before committees resume. My bill, Senate Bill 8619, would require that all legislation that mandates or imposes new or expanded insurance coverage to have a fiscal note attached. What this bill doesn't do is limit or discourage expanding benefits or services. It provides for fiscal clarity and transparency to help us, to help lawmakers, and to help the consumers and the people we represent anticipate and prepare for the financial impacts. Mr. President, I will be voting no on the bill before us. Thank you.
Are there any other senators wishing to be heard? Secretary will ring the bell. Seeing and hearing none, debate is closed. Secretary will ring the bell. Read the last section.
Section 4, this act shall take effect immediately.
Call the roll.
Adabo, Giannaris Kruger, Ort, Stewart-Cousins, White.
Senator Bailey to explain his vote.
Thank you, Mr. President. Thank you, Senator Helming, for the debate on the bill. And look, fiscal restraint is really important, and I agree with my colleague there. As a father of three, as someone who has enjoyed the benefits, the bountiful benefits of a family, I think everybody should be able to enjoy that, and we shouldn't be limiting that. In New York State, this was the first legislative chamber in the entire country to pass a bill like this relating to commercial insurance. You know, it shouldn't take a medical emergency or something that would make you medically infertile for you to be able to have access to this type of care. I believe in choice, and I believe in choice. Choice relates not just to how you go about, having your family, but when, and you should be able to decide that. So I support this bill wholeheartedly, and I'm actually excited I finally got to debate here. I vote aye, Mr. President.
Senator Bailey recorded in the affirmative. Announce the results.
In relation to counter 56 voting in the negative, all Senators Ashby, Borrello, Canzeri, Fitzpatrick, Helming, Murray, O'Mara, Ort, Stett, Tedisco, Walzig, and White. Ayes 47, nays 11.
Bill is passed. Senator Giannaris, that completes the reading of the controversial calendar.
On behalf of Majority Leader Stewart-Cousins, in consultation with Senator Ord, I hand up the following committee assignment of the Minority Conference and ask that it be filed in the Journal.
The hand-up is received and shall be filed in the Journal. Senator Giannaris.
Is there any further business at the desk?
There is no further business at the desk.
Move to adjourn until tomorrow, Wednesday, January 28th at 3 p.m.
On motion, the Senate stands adjourned until Wednesday, January 28th at 3 p.m.